Okay, no more delays. Let's get started. Uh, Welcome to Anatomy Physiology. Today's lecture number one. We have group 69. And today is the first lecture. And want to tell you is this. For the next two, three quizzes, you need to take advantage of this because this lecture one and lecture two and lecture three basically is review from bioscience. So we are going to talk about a lot of the topics that we talk in bioscience, and this is a review, but I'm going to try to get more information, adding on what you already know. But these three first quizzes, take advantage, try to get the highest grade you can, okay? All right, so let's get started. All right, so here we have the vitreous map. And the vitreous, just a moment, I need to put my, okay. Sorry. This is the vitreous map. Vitreous. This is what we call the anatomical position. Question for the exam. Anatomical position.
Victory.
Okay? Vitreous. This is the anatomical position. What is anatomical position? Is standing up with the palms in front. In front. So please, in front. I don't say the palms down or palms up. The palms in front so you can see it. So that is the anatomical position. And this anatomical position is crucial when you're going to see X-rays, MRIs, ultrasound, CT scans, pictures in the books. All of them are going to have the same orientation. The same orientation that is called the anatomical position. All right, so let's get started. So anatomy. Anatomy is coming from the word anatomia, that means separate, to dissect, to separate. So that is anatomy, to dissect, to separate organs and tissues. And this is the study of, and the anatomy that we are going to mention or teach to in this course is the gross anatomy. The gross anatomy, as you can see, is the study of the structures visible with your eighth eye, so with your bare eyes. So whatever you describe, position, location, color, shape, weight, all that are going to be called the gross anatomy. That is the type of anatomy that we are going to need for your nursing program, okay? Or LVM program. All right, so what is physiology? We have anatomy that is most of the time a course, but nowadays we put it or integrate the anatomy with the physiology. So knowing the description of the organs, we need to know what is the function, what is for the function of this organ. Physiology means actually the study of the function of the organ or system. Okay? So a study of the function. Function. What is the function of the kidney? That is physiology. What is the function of the stomach, brain, etc. All right. So that is actually anatomy and physiology. We have pathology here, and the pathology is the study of the disease. A study of a disease. A study of the disease. So what is a disease? A disease is going to be everything, anytime when the function of any system or organ in your body are going to be in abnormal range. For example, you have gastric acid, physiology. Gastric acid physiology means that you produce certain amount of gastric acid in your stomach. So there's a range, there's a volume and a pH of your gastric acid that is normal. But when it's in excess, that is overpass the normal values of the secretion of the stomach, and that is going to lead into pathology. In conclusion, what I want you to remember is pathology is when they go out of range, beyond the range of normal function of the organ. For example, you have hypothyroidism. Do you know somebody with hypothyroidism? Why? Because the hormones of T3 and T4 are low. Low. So low from where? From the normal values. You have the normal values of T3 and T4. If they're too low, it's hypothyroidism. That is a pathology. So it's going to be beyond the normal values of the function of the organ. And the same thing when you have hyperthyroidism. Hyperthyroidism, you have excess of T3 and T4. Okay? So that is pathology. Pathology means that everything that is being out of the range of normal function of the organ, that is considered a pathology, right? And pathology is the study of the disease, a study of the disease. So we are going to study the disease. What means the study of the disease? The study of the disease is very, I will just mention, the definition. We have, for example, the risk factors. We have the etiology, the cause of the disease, the signs and symptoms, the laboratory tests, the diagnosis, the prognosis, the treatment. So prognosis, treatment, differential diagnosis. So many components are part of the pathology. What is pathology at the end? Pathology is the study of the disease. Okay? You okay with that?
Yes. Yes.
Please help me, okay? I sick here. I don't want to feel sorry for anybody feel sorry about me, but I demand help. I need participation. Okay? All right. So here we have here this head is actually what I was mentioning. That is the study guide. Okay, so the 6 levels of organization. The 6 levels of organization go from smaller to bigger, right? Very simple. And that is a question for the exam again. So you're going to start with molecules. Molecules, what is a molecule? A group of atoms. These atoms are going to form, they're going to organize what we call the organelles. Organelles. If you don't know what is organelles, it's something that we saw in bioscience, you must know. What is organelle? Organelle is any of the structures that are inside the cells. Whatever is inside the cells, the mitochondria, the Golgi apparatus, the endoplasmatic reticulum, the nucleus, the lysosome, centrioles, whatever you actually find inside the cell, each of them is called an organelle. Okay, the organelle. So the molecules are coming together to form what we call the organelles. Now, here we have organelles inside the cell, in the nucleus, and all together these are going to form what we call a cell. So organelles coming together form a cell. Now, a group of cells are going to form a tissue. A tissue are going to form for example, organs. For example, let's talk about the stomach. The stomach, as you know, for bioscience, we have 3 layers. The inner layer, that is the epithelium, right? We have the muscle, the smooth muscle, that is part of the wall of the stomach. That's why the stomach can contract, right? The stomach contract. And the other layer is an adventitia. So we have many tissues that are going to form part of the organ. So a group of cells, conclusion, a group of cells are going to form what we call a tissue. Now the tissues are going to form the systems. So organs, tissue, organs, and then the systems. The system. What are the systems? System, for example, we have 11 systems. 11 systems. 11 systems. Some people say 12, but we're going to, for the course, 11. 11 systems. 11 systems, we have, for example, the respiratory system. We have the gastrointestinal system. we have the endocrine system. Endocrine system is a group of glands. The gastrointestinal system is composed by the stomach, large, small intestine, liver, pancreas, gallbladder, teeth, tongue, esophagus, salivary glands. So all these together are going to be a group of organs that together form what we call a system. So when you have a group of organs, they're going to lead into what we call a system. And the systems together, the 11 systems, are going to form what we call your body, your organism. So this is question for the exam. Open eyes, open ears. Open eyes, open ears. Molecules, organelles, cells, tissue, organ systems, and the organism. Here we have, for example, the gastrointestinal system that is going to be the mouth, the esophagus, the stomach. So all these are different organs. Esophagus is an organ. The stomach is another organ. Small and large intestine, each of them is an organ. Rectum, another organ. Anus, another organ. Salivary glands, parotid glands, etc. Pancreas, liver, gallbladder. So all that are organs. All organs together, put together, are going to form what we call a system. A system. Is in this case the gastrointestinal system. We have the urinary system. Urinary system composed by different organs, like the kidney, the ureters, urinary bladder, the urethra. We have the endocrine system composed by different organs, thymus, tonsils, adenoids, pituitary gland, adrenal gland, thyroid gland. All together are going to form the endocrine system. The nervous system composed by the central nervous system that is composed by the cerebrum, cerebellum, the brain stem, and the spinal cord. So all these different organs are coming together to form a system. And that peripheral nervous system, that is the one who gives branches to the muscles and organs. So all together, these structures are going to form a system, the nervous system. Okay? Okay, so let's see. All right, so we have 11 systems. 11 systems. All right, so for this, I just want you to remember a few things here. You need to remember that we have 11 systems. We have the reproductive system, that is female, male, urinary system, digestive system, respiratory system, the lymphatic system composed with the lymphatic nodes as well, as you know, and the lymphatic organs, like lymphatic nodes, the tonsils, adenoids, etc. Cardiovascular system, heart and arteries and veins. Endocrine system, the nervous system, the muscular system, how many type of muscles you have. You should know already that, right? Smooth, straight, and cardiac, 3 type of muscle. A skeletal system, all the skeletal system of the body. And I lead at the end what we call the integumentary system or integument system. Integument system, integument system, that is basically the skin, your hair, your nails, the mucosas. So all this is the integumentary system, integumentary system, integumentary system, integumentary system, integumentary system. Why I reply so much about that? Because when you're going to do your nursing assessment, you need to start always with the integumentary system. The integumentary system. So when you are, and this is, don't overlook, because if you don't do that, you're going to have a bad start in your nursing. The first thing when you have a patient, you get into the room. The first thing you're observing the patient. You're using your time 100%. So when you get into the patient, you're watching the skin already. How is the skin of the face, of the arms, how is the hair, how is the nail. So, for example, I will give you something. So, skin, the patient is yellow, yellow or not, jaundice or not. Observation, that is skin. The patient is dehydrated, the mucus are dry, that is integumentary system. You have nails that are fungal infections, the patient needs immunocompromised, your nails are being compromised. It can be immune deficiency, right? Or the distribution of the hair. So you touch the hair and pull the hair. There's a way to do it. If the hair is falling down, that means probably an hypothyroidism. Just looking at the skin of the patient. The skin of the patient includes the sclera of the eye. The eye is yellow, have jaundice, have a bilirubin elevation, right? And that is the very, very beginning. So how long is it going to take you to do that? Few seconds. The patient doesn't know you're doing that. So, and that is the first step on the physical exam, in the physical assessment of the patient, the integumentary system. You can say integument, or you can say integumentary system, okay? Or just integument or integumentary system is the same. Integument. When you say integument, means skin. You okay with that?
Yes.
Yes.
Yeah.
Okay. The integumentary system, we have the skin and the appendages. Skin and appendages. What are the appendages? The nails, the hair. The hair, the distribution of hair in the body. All right. So, for example, puberty, adolescence, the distribution of hair is going to be different for male and female. It's probably somebody has some hormone deficiencies. So the distribution of the hair in the male, you need to identify how is the distribution of the hair, right? For example, in female, the pubic hair is going to be triangular. Meantime, in male, is going to be like a rhomboid. Rhomboid, what is rhomboid? Like this. Female, the pubic hair is going to distribute. They can lead you and tell you that probably you have some hormonal deficiencies. That is just one example of many. Nails, the shape of the nails. The shape of the nails, they can tell you that you have cardiovascular problems of long data or for respiratory problems. So the skin is a window of so much information that you can get from the patient. It's a lot of information. So skin and appendage. So that include the hair, the nails, the glands that protect against invading foreign microorganisms. So the skin is the first line of defense. First line of defense. Right? So that is bioscience. The first line of defense is the integumentary system. It's going to isolate us from the external environment. And that means that they are going to prevent the entry or invasion of bacteria. All right, so that is the integumentary system. Skeletal system. And Marcel, next class, when I'm going to be better, hopefully, I'm going to do a demonstration how to check the inspection of the skin. So, integumentary system. Okay with that? Just remind me that, please. Okay?
Yeah.
Okay. Skeletal system, you are going to imagine yourself without bones. So you have your bones on your hands and your cranium. Imagine you don't have bones. If you don't have bones, what is going to happen? You're going to be like a big amoeba, right? You don't want to be a big amoeba. You want to walk, you want to run, what you're going to do? Crawl. So because you don't have bones, and bones are going to give you the locomotion, and it's going to give you the protection from organs. The cranium protects the brain. The vertebrae protect the spinal cord. The thorax protect the lungs and the heart. The pelvis, all the internal organs of the pelvis. The locomotion, the ribs are going to, well, I already talked about that. So locomotion, the movement, the walking, the running, all that is being by the bones. Plus other functions that we already talked, and we are going to talk again. For example, the source of calcium, and the bones produce red blood cells as well. Okay, the muscular system. The muscular system, and this is just an overview, because in the next lectures, we are going to talk about skin, only skin, only skin. We are talking only about bones, only about muscular, but this is just overview. Muscular system, this is something that you must remember. Don't wait until then, because you have more information to cover. So we have about 600 different muscles, and we have 3 types of muscles. The type of muscles that you need to remember are going to be the smooth or involuntary muscle, the skeletal muscle, striate muscle, or voluntary muscle, and number 3, the cardiac muscle. So there is 3 muscles that we have. In the skeletal system, going back, skeletal system, we have 206 bones. We have 206 bones. What you need to remember about that, what are the cells of the bone? Osteoblast, osteoclast, osteocyte. So that is the minimum that you need to know what is coming. Okay, I'm telling you ahead of time. And that is not new. Nervous system. The nervous system are going to be composed by nerve cells. The nerve cells, what you need to remember is the nervous system are divided into the central nervous system and the peripheral nervous system. The central nervous system, critical thinking starts with the definitions of what the words you are talking about. Central nervous system is the nervous tissue that is in the center of your body. It's the brain and the spinal cord. That is not in the center of your body? The answer is yes, right? So that's why it's called central nervous system. And all these nerves that are coming out from the spinal cord, towards your upper, lower, and internal organs, all these branches, like the branches of a tree, you have a tree. The main trunk in the center, that is the central nervous system. And the branches are going to be the peripheral nervous system. So that is the division of the nervous system, central and peripheral nervous system. We are going to talk about the sympathetic, parasympathetic, that is coming. This is something that is not new. It's something that you already know. And that, based on that, are going to use that knowledge to keep forward. So you must review in this time, in these days, all the material of bioscience. Okay? Endocrine system, we have system of glands that produce endocrine secretions. All right. So what is endocrine system? Endo means inside. And this is the classification of the glands. Glands, we have 2 types of glands, the exocrine, and the endocrine. The exocrine are those glands who have a duct. For example, the salivary gland. This is the skin. This is the tube or the duct of the salivary gland where it's going to drain fluid, the sweating, and here is the gland connected to the tube. So this duct is going to make this gland called an exocrine gland. Other glands that we are going to talk is the endocrine gland. These endocrine glands are ductless. So they don't have a duct. So for example, the thyroid gland, adrenal gland, etc. Okay? The cardiovascular system. So please, how many of you are missing a part of what I just said? When I say cardiovascular, what do you think? Heart. You're missing a part. What is the other part? Vascular. Read carefully, careful what you are having in front of you. Cardiovascular is the heart and the arteries and veins. So cardiovascular system. The lymphatic system, we already talked about the lymphatic system. What you need to know about the lymphatic system is that it's composed by the lymphatic vessels and the lymphatic nodes. Lymphatic nodes. That is the basic thing about the lymphatic system. And the function of the lymphatic system, as you already remember, is the transportation of immune cells like lymphocytes, transportation of proteins and fats, and the absorption of the excess of fluid, water, on that tissue. Okay, so those are the three functions that you must remember, and we are going to use when the time comes. All right, so we have the respiratory system, and the respiratory system are going to be composed by the lungs and the respiratory tract. So please be careful what I just said. So respiratory system are going to be composed by the respiratory tract and the lungs. Tract is not the same to say system. Tract is all the tubing. So all the tubing, all the trachea, the bronchi, and the 23 divisions of the bronchi. All these tubings are going to be the respiratory tract and the lungs. So the respiratory tract plus lungs are going to be the respiratory system. System is a group of organs. Which organs? The lungs and the respiratory tract. That is the trachea and the bronchi. We have the digestive system. In the digestive system, we have the digestive system or gastrointestinal system, or gastrointestinal, is composed by the gastrointestinal tract and the accessory organs. The GI tract are always, it's going to be, again, the tubing. What tubes? Esophagus is a tube, stomach, small, large intestine. Those are tubes. That is the GI tract. Tract is not the same to say system. Okay? System is a group of organs. So the tract, GI tract, plus the accessory organ. What are the accessory organs? The liver, gallbladder, pancreas, salivary glands, teeth, tongue. So those are the accessory organs of the digestive system. Okay? So you need to remember minimum that. Another thing that you need to remember is the urinary system. The urinary system, we have two divisions. It's going to be the urinary urinary tract, and the kidneys. Okay, so the urinary tract are the tubing, all the pelvis, all the ureters, all the actually the urethra. So all what is cavity is the urinary tract. And we are going to make the division of upper and lower GI tract, and there are going to be upper GI tract include the kidneys and include the ureters, and the lower urinary tract include the urinary bladder and the urethra, urinary system. So at this moment, we are going to just mention, this is just a review. What I'm trying to do here is you to go and review your notes on bioscience of each of these systems. You don't need to spend 2 hours for each system. Spend 20, 30 minutes per system and try to review everything that you got. That is going to be so important in order to get the best benefit of this course. Reproductive system, we will talk about male and female reproductive system. And another word that we are going to talk about is the, let me see here. Okay, so we have metabolism. Now, this is your super favorite picture. Remember this picture?
Yes.
Yep.
Yeah, thank you. All right, so this is these three lectures is all bioscience. And we are going to put all the bioscience into these three lectures. So this is very important to remember because metabolism is just not one slide, two slides. It's going to be the whole life because this chart you're going to use, especially in diabetes mellitus. And diabetes mellitus are going to be the bread and butter because everybody, you will see, wherever you go, you will find somebody with diabetes mellitus. So that is your bread and butter every day. One of the few, well, you need to know everything, but diabetes need to be known very, 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 very clear. And for this, you need to use your knowledge of the metabolism. All right. So let's make it simple. Metabolism is, in other words, in other words, are going to be how the body produces energy. Simple. I don't want you to elaborate or get tangled with a lot of definitions of metabolism. I just to make a clear idea, for example, when you are doing exercises, your metabolism is very common to say that, right? When you're doing exercises, your metabolism going up or down.
Up.
Everybody,
Up.
up or down?
It's up.
Somebody said down. Who said down? Somebody said down.
No, up.
Okay, it's my hallucinations. Okay, good. Okay, so metabolism go up. When metabolism go up, what does it mean, Jessica? That you need more energy, yes or no? Right? If you need more energy, that means that you produce more energy, more ATPs. I can talk about ATPs, right? Everybody knows what is ATP. Everybody's aware of what is ATP? Everybody?
Yes. Yes.
Yes.
Excellent. All right, so metabolism, what is metabolism? So Alma, if I ask you, your metabolism go up, what does it mean? That your body are going to need to produce more
More energy.
ATPs, more energy. You okay with that? Shanna, if you are in couch potato, lazy, don't do anything, vacations, your metabolism will go down, correct?
Yes.
And that means that you will need less energy. So what is metabolism at the end? In few words, don't spend too much time just trying to be academically perfect. No, 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 no. Yes, the concept is what is important. Metabolism is how your body produces energy. How your body produces energy. Simple as that. Okay with that?
Yes.
The body is going to produce energy from sugars, from glycogen, glucose, right? And that is going to enter into the Krebs cycle, right? And that is the main metabolic process that is involving the pathology of diabetes mellitus. You can understand all the laboratory tests, you can anticipate. You're going to know what is the nutrient, what is the diet, just knowing that process. So that is your skeleton, that is your frame. So that's why you need to know very well what is metabolism. All right. All right, so there is another way that they're going to define metabolism. That is a process called catabolism and anabolism. So what is metabolism? How, I'm going to put it here, how body produce energy. And the other form to describe metabolism is the summation of catabolism plus anabolism. Plus, I said plus, anabolism. What means anabolism? Anabolism means building up. And catabolism is breaking down. Breaking down what? The nutrients. Building up what? Proteins. Okay, catabolism and anabolism. So your metabolism. So for example, I will tell you. Metabolism. The metabolism of a baby and the metabolism of the elderly are the same?
Yeah.
No, right? So the baby is going to basically are going to be his body is going to be more busy building up, building up, building up. And the elderly people cannot build up as before. So everything with the age is going to decay because we cannot create or replace as fast as we did in the past to create, to replace. The window of your house, the window of your house has 100 years. They need to be replaced. They need to have maintenance. But with the time, you cannot do that because you lose the ability to replace that window. It's exactly the same what happens with your body. Your body is your house. So when you get older, you cannot have that, you are not anabolic as when you were before. And catabolic, what is catabolic? So please listen to this, okay? Catabolic is when you break down nutrients. Why do you need to break down nutrients?
For energy.
For
Who
energy.
said that? Excellent, beautiful. For energy, for energy. And where is coming that energy from?
Food.
From the nutrients, right? From your carbohydrates, from your proteins, from your lipids, right? So that is catabolic. Tell me one thing. When you are sick, when you are sick, you are more anabolic or more catabolic? When you are sick, I will give you the introduction. When you are sick, that means where is coming the signs and symptoms? Where are coming signs and symptoms? Listen to this. Signs and symptoms, pain, fever, whatever you have, are coming from the destruction of cells. Cell destruction. So the more signs and symptoms you have means that your body are suffering more destruction of the cells. Make sense? We gave it that? Okay. So that is number one. The number two is this. If you are your body is being destroyed, destroying cells because of the disease, signs and symptoms, what's supposed the body need to do?
Anabolic.
The body need to be anabolic, yes, to need to replace the tissue that are being damaged, correct? But in order to replace means that you need to have cell division. You need to the cells need to multiply, and this multiplication is for free. This activity is going to be just from heaven and say, oh yeah, multiply and multiply. No, because the cell division needs energy, correct? In order to replace your tissue who are being damaged, you're going to use the reservoirs of, of carbohydrates and fats in your body. You want proof of that? I will give you proof of that. Tell me, when you get sick, you gain or lose weight?
Lose weight.
Lose weight. Why? Because your tissues are being damaged, replaced, need to be replaced by new cells. And for that, you need the energy, the storage of your nutrients in your body. So that's why you are using your carbohydrates, your fats, and that's why you lose weight. Why? Because when you are sick, you are more catabolic than anabolic. In conclusion, babies are more anabolic than catabolic. Babies are more anabolic. The younger you are, the more anabolic, are in young and less catabolic. In adult is the opposite. You are more catabolic. You are more anabolic. 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 You are more you are more catabolic than anabolic. So what is metabolism? Metabolism is the summation of reactions, anabolic reactions and catabolic reactions. Another way to say metabolism, how the body produces energy. Steffi, you okay?
Yeah.
It's clear? Okay.
Yes.
Okay. Okay, so this is our super favorite. This is the glycolysis, 2 ATPs, cytoplasm, anaerobic, reversible reaction, pyruvic acid for glucose. And we have irreversible reaction, the acetyl-CoA with the pyruvic acid, that they get into the mitochondria to produce to get into the Krebs cycle to produce the ATPs. All right, so now, this is the first lecture I want to tell you a few things, and this is already known in bioscience. Why do we need to eat? Why we need to eat food? Why we just not inhale air and we just alive? Why we need to?
We need energy and nutrients.
Okay, so the nutrients is to create to the energy to produce ATPs. Listen, the energy that is in the food, you don't use that directly. That energy that is stored in the foods are being used to produce ATPs. And are the ATPs that you use for energy. The food is the source to produce ATPs. But the one that you use for energy is the ATPs. Is that clear?
Mm-hmm. Clear.
All right, so that is why we need to eat. Why we need oxygen. To breathe. No, that is not an answer.
Our cells need aerobic oxygen for aerobic reactions.
Exactly. The Krebs cycle need oxygen in order to have all these chemical reactions occur to produce ATPs. So that's why we need oxygen, because our body is aerobic, having aerobic reactions to produce ATPs. You okay with that?
Yes.
Don't tell me you forgot, because I'm going to ask that, okay? And the third one, why we need to drink water? Why we need water? Why we don't, you say, oh, I need beer, I don't need water, I need vodka or whatever. No, so water, why you need water?
Please,
To help digest your food and get rid of waste and keep your organs hydrated.
Okay, that is part of that. Why we need water? I will tell you, if I tell you, don't forget, okay? Emerald, you don't forget, okay? Okay. We need water because that is the medium where chemical reactions are going to happen. So all these catabolic reactions, all these anabolic reactions are going to occur in water. So it's the medium, in other words. Is the medium is where chemical reactions happen. So tell me one thing, Erica, if you don't have water, do you have efficiently chemical reactions?
No, not at all.
Not at all. And that means that you produce less or more ATPs.
You would produce less.
Less ATP. Excellent. So a patient who is dehydrated, the first thing you're going to do is hydrate the patient to give the medium, the water, to chemical reactions occur. So otherwise, the patient will not heal. All right? Okay. So that's, you know, why we need oxygen, why we need water, and why we need food. Okay? All right, so the other term that we need to remember is the homeostasis. Homeostasis. What is homeostasis? That is a must that you need to know for this course. Huh? Homeostasis is how the body keep the internal balance. In few words, homeostasis, internal balance. Homeostasis, internal balance. Give me one example of homeostasis.
Blood pressure.
Yeah, blood pressure. Another one will be, for example, dehydration. Dehydration. So tell me, I will tell. So what? Listen to the definition. It's how the body works to keep the internal balance. Think about those words. How the body is going to, what the body is doing to keep the internal balance. For example, if you are dehydrated, tell me, do you pee more or pee less?
Less.
Be less.
You pee less, right? Why? Because the body is trying to keep all the water possible inside your body, trying to keep the internal balance. Got it? Okay? So, and there's many reasons, many others. The pH, we are going to talk today a little bit, etc. All right, so that is homeostasis. Homeostasis of the calcium, for example, right? Remember homeostasis of the calcium, the parathyroid hormone, the calcitonin, the osteoclast, the osteoblast. So those are of how the body is trying to keep the internal balance of calcium. But please don't think calcium like the bones only. Yeah, the calcium is, bones are going to be main component of calcium, but calcium is used for other components. Calcium is used for muscle contraction, cardiac activity. Calcium is needed for the nervous system. And you need to have a normal value range of calcium. The calcium is in the normal values in blood. When you have too much or too low, that is produce pathology. And for that are going to trigger the homeostatic process. That is the calcitonin and the PTH to control the calcium values in blood. If you get confused on that, I'm not, I will not upset with that because it's not easy, but we are going to see that in the time when this comes. So I just mentioned that, okay? So homeostasis is a very wide, broad term that are going to participate in all the functions of the body. Okay. Homeostasis. Okay, fluid balance. So they like to talk about fluid balance here. And talking about fluid balance, I need to go into a few things here. Number one is you need to know this for example. Here we have a cell here, in the nucleus, and that cell is actually, we have the cytoplasm here, and that is the intracellular space, intracellular, intra means inside. Extra, and outside the cell is called the extracellular. Extracellular is the extracellular. All right, so in the intracellular, we are going to have very important components. You already know that we talk about, listen to this, please. This is, we have elements or minerals. What is that? That is in the periodic table of Mendeleev. Hydrogen, lithium, sodium, potassium, rubidium, cesium, francium, whatever, all these elements that you already know from the periodic table. These elements or minerals that are in the periodic table, remember the periodic table, they do not have charge, no charge. But when these elements or minerals are going to lose or gain electrons, they are going to turn into ions. So these elements do not have, or minerals do not have charge. When they lose or gain an electron, that is called an ion. So that is going to be charge, electrical charge. And these ions are going to be divided into cations and anions. These cations are positive. How to remember that? I told you that. Cations, cations, T, is positive. If cation is positive, anion is negative. Okay? You okay with that?
Yes.
Yes.
Okay. Now, we have another term that are going to be called the electrolytes. Electrolyte. Don't get confused. It's very simple. Electrolytes are ions, but electrolytes are called electrolytes when these ions are in body fluids. In body fluids. So that is an electrolyte. Electrolytes are going to be ions. Ions, yes, electrical charge, cations and anions. But when they are in body fluids, are going to be called electrolytes. Is that clear?
Yes.
Yes.
Okay. Now, I'm saying that because this is an important concept. We need to have these electrolytes are going to be located in different proportions. So number one, in the extracellular, we are going to have a cation that is the sodium cation. And we have the chloride that is an anion. So for the exam, you need to remember sodium is plus. You cannot put sodium like this. That is nothing. You need to put complete, positive. Okay? Because the exam is coming like that. It's not going to put you sodium positive, no. They are going to give you the symbol and the charge. Okay. So, sodium. Okay. And intracellular, we are going to have another element, it's an electrolyte called the potassium, and we have the phosphate. The phosphate. So this is what you must remember for your exam. Must remember. You want to lose, you want to money in your pocket, learn this. All right, so how to remember this? This is a repetition, I said, from bioscience, so I'm trying to make it easy. So here we have potassium and phosphate. So why we have phosphate inside the cell most commonly, and more abundant? So somebody can tell me? Why phosphate are in highest amount inside the cells?
So it creates the membranes. It's needed for energy.
Exactly. You have ADP. The ADP, they are going to add a phosphate to produce ATPs. So that's why the phosphate are going to be most commonly in the intracellular space. Okay? Okay. What is this? What is doing this? Why is doing that? Okay, that is the intra. This is the intra. Okay. Now, potassium and phosphate. All right, so how to remember this? So what I do, I told you before, if you have a plate here, this is the plate. Let's have a lunch, okay? They have lunch. This is your plate. Here we have your chicken, whatever you like to eat, your rice, broccoli, whatever, right? So that is inside your plate. But what happened outside the plate, you will have here a salt shaker. Yes or no? Right? And what is the salt shaker? Salt shaker is sodium chloride. Sodium chloride. Sodium chloride. So now, this salt shaker is going to be outside of the plate. What is the plate? The plate represents your cell, the cell. You don't put the salt shaker inside here on the plate, right? You don't put it there. It's always outside. So, and that is how you are going to remember the sodium chloride are extracellular. And you need to remember the potassium and the phosphate that are the intracellular. So I'm going to ask you like this. What is the most important extracellular cation? The sodium. What is the most important intracellular cation? Potassium. What is the most important intracellular anion? Phosphate. What is the most important extracellular anion? You will tell me the chloride. Okay?
Yes.
Okay. So when you're talking about fluid balance, when you have fluid balance, the fluid balance, when you're talking about fluid balance, the main organ to control the fluid balance are the kidneys. Main organ for fluid balance, the kidneys. Okay? The kidneys. Another thing that you need to remember is the sodium. The sodium attracts water. This is huge. What is your name? That is your name now. Sodium attracts water. Okay? Sodium attracts water. Never forget that. If you forget that, don't forget that. Okay? All right. Eubulimia, just to mention, eu means true, real. Eubulimia is normal volume of fluid in the body. Eubulimia. It sounds like Portuguese, right? So, eubulimia means true volume or normal volume of fluid in the body. Okay?
Yes.
Okay. All right, so here we have effect of aging. We are going to talk about, for example, when you get older, there is, I want you to realize this, please, okay? So I'm going to make a big difference here. Collagen, collagen. Fabian, you know what is collagen? Somebody know what is collagen? What is collagen?
Is it in the skin? I don't know. Elasticity, maybe?
Exactly, it's a protein, right? Write down 10 times. Collagen is a protein. Very good. Collagen is a protein. Write it down. I said write it down. Collagen is a protein. As Alma said very well, it's an elastic protein. Elastic protein. Marcel, you know what I'm going to now. I know that. So, but collagen is an elastic protein. Okay? We get that? Now, Fabian, I see you are very young. You don't have any wrinkles at all. Why is that? Stephanie, you don't have wrinkles neither. See? Why? Because you have a lot of collagen. So you want your skin, the face of your skin, you want elastic or no elastic? You want elastic, right?
Yeah.
Excellent. So, and that's because you are young. And why? Because you are more anabolic. Anabolic. You are building up more. What in this case? Collagen. Got it? But when you get older, you are less anabolic, but more catabolic. So that means that when you get older, you don't produce enough collagen as when you were younger. So what happened? The skin loses the elasticity, or no? Because you are more catabolic. You're not that anabolic anymore. You don't produce that elastic collagen that you used to have when you were younger. So what happened? The face starts to shrink. You okay with that? But basically, but this is more than that. For example, collagen, please open your eyes very clear, or very wide. Collagen is located not only in the skin. Collagen is going to be everywhere. It's going to be in your muscles. It's going to be in your tendons. It's going to be in the walls of the arteries and veins. Right? So when you are young, this collagen in the muscles give you a lot of flexibility, or no? Yes or no?
Yes.
Your vessels are very elastic when you are young because you have a lot of collagen. But what happened with the elderly people? The elderly people become more rigid, stiff, or no? Yes or no?
Yes.
Yes.
Stiff.
Right? And why? Because basically they lose the collagen from the muscles and tendons. So their muscles are not elastic as before. So that's why they become rigid, stiff. The arteries walls, the arteries and veins. Somebody's phlebotomist here? Somebody phlebotomist? Technically, you're a phlebotomist, right?
I've been a fleb.
Somebody's phlebotomist, no?
Yes.
All right, so you know that a phlebotomist, when you have an elderly people, it's very easy to brittle the vessels or arteries, or the veins, sorry, when they are pinching on the veins. Do you notice that? It's more difficult to find or to break a vessel in the elderly people. Why? Because the walls of the veins are become more rigid because they don't have enough collagen. So any trauma, mechanical force destroy the vein and burst. Okay? All right, so you already know. So for example, you have an elderly people who are holding, open the door, and they take a longer time to get his hand off of the door. Yes or no?
Yes.
Yeah, it takes him longer.
Right? Why? Because of the collagen. Got it?
Yes.
So when you go out of the class, go see around you and see who has more collagen, who has more collagen. The more elastic, less elasticity. See around elderly people. Apply what you say, what you see in class. All right, so let's keep moving. So shrink and lose mass, stiffness, strength decrease, the heart. Why the people get elderly people get tired faster than young people? Because the heart is not contracting as before. It's going to be a little bit more weaker. So that means that the heart do not pump blood to the lungs to receive oxygen. It's not going to be as efficient as before. So it's going to be blood cannot oxygenate because the heart cannot pump the blood towards the lungs as before. And that's why you are going to feel that you cannot oxygenate, lack of oxygen, and that can lead into fatigue, into be actually tired faster than before. You okay with that? Okay? So you can tell in conclusion, to do a recap here, that there is anabolism implied, catabolism, metabolism, and age. Young people, elderly people. And that is the big difference and the big concept that we need to learn in this class, in this part of the class. Okay, so I'm not going to go on that. Body cavities. This is the last time probably we are going to talk about body cavities. You need to know the directions, and then we are going to talk about molecules and all that. They need to. This is fast. All right, so we have the cavities: ventral cavity and the dorsal cavity. dorsal cavity and ventral cavity. The dorsal cavity is this. This is the dorsal cavity, the dorsal. All this. All this is a cavity. All what is a tunnel, this is a channel, cavity. Here we have the cranial cavity, where is going to be the brain. Please, you need to know the division of the brain. Brain is the cerebrum, cerebellum, and the brain stem. Cerebellum and brain stem. So that is the brain. This is the brain here. And the spinal cord. So brain, the brain is going to be cerebrum, cerebellum, and brain stem. Then we have the spinal cord, and just to not lose the respective, brain and spinal cord are what we call the central nervous system. So the central nervous system is divided into the brain and the spinal cord. The brain is here. The spinal cord is here. Okay, so brain is composed by cerebrum, cerebellum, and brain stem. All right, so these are located in the dorsal cavity. Dorsal cavity is divided in the spinal cavity because the vertebrae, they have what we call the vertebral canal. Vertebral canal, where it's passing the spinal cord. Okay, so that is in space, it's like a tunnel. And that is the dorsal cavity. Then we have the ventral cavity. The ventral cavity are going to be the anterior portion of the body, thoracic cavity, and the abdominal pelvic area. I didn't say abdominal area only. I said abdominal pelvic or abdominal pelvic cavity. So that is what you need to measure. So ventral cavity are divided into thoracic and abdominal pelvic cavity. The abdominal pelvic cavity now is subdivided in abdominal and pelvic cavity. Okay? Okay. So one thing you need to remember is that the ventral cavity is divided by this muscle that is called the diaphragm. We don't have the diaphragm here. So that's why you cannot divide the abdomen with the pelvis. So that is called the abdominal pelvic cavity, because there is no diaphragm here below. Okay? Okay. All right, so here we have the quadrants and the regions. In the regions, here we have 9 regions here, 9. And here we have 4 quadrants, 4 quadrants. So for the exam, you must know the names of all of them and what is the main organs located in each region. Here we have the hypochondria, question for the exam. Hypo means below chondriac cartilage, below the ribs. Question for the exam. That is open eyes, open ears. Okay, hypochondriac. So I want you to touch the ribs of your hypochondriac area, the lower portion of the ribs. Up to there is the hypochondriac region. Below that is different area, region. But whatever is under, or no, behind, let's put it that, of the ribs, that is the hypochondriac. Okay? Hypochondria below or under or behind the ribs. The right hypochondriac, if we have right hypochondriac, we have left hypochondriac. Now, here we have the right lumbar region, that is right lumbar region of flank or lumbar. If we have right lumbar region, we have the left lumbar region or left flank. So we have right flank, left flank, or right lumbar, left lumbar. Right hypochondriac, left hypochondriac. Let's keep going down. We have the iliac or inguinal. Inguinal. So we have right iliac or left iliac on the other side. We have right inguinal or left inguinal. Okay, so that is, so these three are, you need to be very, well, all of them, right? So hypochondriac, lumbar, inguinal. Hypochondriac, lumbar, inguinal. In the center, we have, let's start with this, the center is the easy one, is the umbilical region. Is the umbilical region. The umbilical region. Above the umbilical region, we have the epigastric. Epi means above. Epigastric region. The epigastric region. The epigastric region. The epigastric region. You okay with that? Okay. And below that, we have the hypogastric region. We have the hypogastric region. So we have 9 regions. So for the exam, you need to, I'm going to ask you like this. What is superior to the umbilical region? The epigastric region. What is inferior to the left hypochondrial region? What is inferior? The left lumbar region. What is superior to the right inguinal region? The right lumbar region. What is lateral to the hypogastric? The inguinal regions. What is medial to the hypochondriac region? Epigastric region. So there's different ways, like I can ask you the same thing. You okay with that?
Yes.
But that is not enough, because in addition to that, what I'm going to ask you is what is the main organs located in each of these regions. I teach cross-sectional anatomy. I can give you more than 5, 6, 10 relationships, but we are going to do only one per region. Okay? Number 1. Here we have the right hypochondrial region. We have the liver. The liver. We have the gallbladder, the second portion of the duodenum, the upper pole of the kidney, the flexure of the colon, the hepatic flexure of the colon. We have the gallbladder, the cystic duct. We have many things there. The only thing I want you to remember is the liver. Okay with that?
Yes.
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 In the other side, and you forgot always about the poor spleen. Don't forget about the spleen. The left hypochondrial region is where we have the spleen. 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 Okay, so on the right we have the liver, on the left we have the spleen. In the epigastric we have the stomach. Liver, stomach, spleen. You need to practice that. The right lumbar region is going to be the ascending colon. Why is called ascending colon? Because the colon is ascending. That's why.
No.
Right? In the left lumbar region, we have the descending colon. And why is called descending colon? Because the colon is descending, going down. So the fecal material goes this way. The umbilical region. What we have in the umbilical region? The small intestine. The right inguinal region, we have the appendix. In the hypogastric region, we have the urinary bladder. We have the uterus, ovaries, fallopian tubes, ligaments, many. Okay. urinary bladder, uterus. And the left iliac, this is a question for the exam, is the colon sigmoid colon. Sigmoid colon is on sigmoid colon is on the left. Sigmoid colon is on the left. You okay with that?
Yes.
All right, so that is the minimum you need to remember about the regions. The four quadrants, we have the landmarks, the mid-clavicular lines, etc. We don't care about that. And here, so we have tried to recognize the four quadrants in your abdomen. Put your finger in your navel. What is the navel here? And across the street. A sagittal plane, mid-sagittal plane, and the transverse plane. So all these quadrant, right? So the navel is the cross street. The right upper quadrant is called, always you start to say right or left, right or left, right or left, right or left. Upper is upper, upper, lower, lower, quadrant at the end, quadrant at the end, quadrant, quadrant. Okay? Okay. When you are going to do your nursing assessment, when you are going to use this, you're going to use this in order to identify what you're eating, Alma. I like it. I'm hungry.
In your documentation,
Huh?
your assessment.
Oh, yeah. Okay. No, but I say, Alma, what are you eating? What is that?
They're just Ritz crackers, or
No.
I'll put it away.
No. That's okay. Okay, so what I say is this, that you need to know the quadrant. Somebody said, I guess, is to identify the pain. The pain. The pain. So when I'm going to be in front of you, I'm going to show you how to assess pain. But at this moment, I cannot do it because difficult. Okay, so pain. So you will say, where is the pain? What I can tell you is this. Put your finger like this. Say, can you show me with one finger where is the pain? Exactly like that. It's not like you're repeating like a parrot. No, everybody say the same. And this is the right way to say. So you need to start doing that. Why you say with one finger? Because people like to exaggerate, right? They put all the hand and you don't know where is the pain, right? So it's going to be more specific if you ask for, show me with one finger where is your pain, and the patient will show you. Okay, and you will put what? Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. That is mostly for pain. When you're talking about regions, it's just to give you an idea which organs are located in that. If you have an epigastric pain, you have an epigastric pain. That is ulcers or no? Gastritis or no? Right? When you have a right hypochondriac pain, gallbladder, cholecystitis, hepatitis or no? Right? When you have left hypochondriac region, you can have a trauma in the ribs that produce bleeding on the spleen. You have pain on the center of the abdomen, in the umbilical region, small intestines, etc. Okay? So that is going to help you to recognize the location of that. There is much more to learn because you need to know the type of pain, visceral, somatic, etc. And this is not your time. Okay? Steffi, we okay with that? Jessica? The nail, they had the nail, and the nail. The nail, can you pronounce your name, please?
Oh, it's Danelle, like Danelle.
Daniel. Okay, okay. Now, Daniel and Daniel are going to be sister and brothers because they have similar name. Okay. All right, so let's keep moving. All right, so talking about the anatomical position. Please, anatomical position is so important. So just remember, whatever is the picture in front of you, is you have a picture in front of you. Doesn't matter if this is CT scan, MRI, whatever imaging you can see, even a simple image of the human body. Remember this, a keyword, opposite. Opposite. This is my right hand. What is in front of me is the left side of the patient. This is my left hand. What is in front of me, that is the right side of the patient. You okay with that? Okay?
Yes. Yes.
And remember, palms open in front. Never palms down, never palms up, in front. That is the anatomical position. The anatomical position, just remember this, your finger is, which finger is the thumb? Is number 1, number 2, number 3, number 4, number 5, the pinky. Okay? So the thumb is number 1. So you count 1, 2, 3, 4, 5. On the toes, very good, Anna. On the toes, you're going to have the opposite. 1 is the big toe. 1, 2, 3, 4, 5. From medial to outer. How to remember that? Very simple. The thumb and the big toe and the thumb are the biggest, right? Are the largest. Those are number 1. Easy? You okay with that?
Yes.
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 Okay. Okay, let me see if I have here. Now that we understood this, tell me this view. So this is a cross section, correct?
Yes. Transverse.
Yeah. All right, so this is the liver, correct? Yes or no?
Yes.
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 This is the stomach. This is the spleen. This is the vertebra. This is the aorta. This is the acidos, the inferior vena cava, hepatic veins, portal veins, etc. Okay. So this image is different if I put it this way. Just a moment. Which is the right orientation? A or B?
B.
B?
B. Yeah.
This is A and this is B.
B.
A and B. Which one is the right?
A.
B.
It
B.
is
B. What's
Why B? Why B? No. It's
And
A.
column.
A.
Oh, oh,
A. So okay, so I will tell you why. Look at this. You need to concentrate your imagination, okay? When you have a patient orientation, this is the anatomical position, the vitreous man. So I'm not going to explain that because we have short of time right now. So, but that is the anatomical position. But anatomical position, when you cross-section of the body, is like you need to put your eyes like you are looking from the feet to the head. From the feet to the head. So you have a cross-section, but your eyes, this is the feet, and more posterior is going to be the head. Because if you look the patient described from the head to the feet, everything is going to be invert. So the anatomical position will be when you have the patient in front of you, with hands in front of you, and when it's a cross section, when you are looking, it's like you are looking from the feet towards the head. Okay with that?
Yeah.
So the right is this, because the liver, where is the liver? The liver, I told you that is in the right hypochondriac, right? Region, yes or no?
Yeah.
And here we have, this is the right hypochondriac. Behind the slide is the head, and towards you are the feet. So you're looking the patient from the feet towards the head. That is the correct orientation. We okay with that?
Yes.
Okay. So let's make it faster, this one, because I need to have. This one. All right, so here we have a man. Okay, this is a man. And here we have a line who is cutting the patient in half. So they are going to cut it into the right and the left, correct? My right is the left, my left is the right, okay? And that is called the mid-sagittal plane. The mid-sagittal plane are going to cut it in right and left. We have another lines are going to be like this. Those are called the parasagittal planes. Parasagittal plane. Why is called parasagittal plane? Because these lines are parallel, parasagittal parallel to the mid-sagittal plane. The mid-sagittal plane cut exactly in half, right and left. Parasagittal plane cut in right and left, but not exactly the half and a half, right? So parasagittal plane and the mid-sagittal plane. Then we have the transverse plane. Transverse plane are going to cut into superior and inferior, right? And you have many planes, transverse. And then we have other planes called the oblique planes, oblique. So there is different ways to cut, oblique. So that is what I call my cookie man. Cookie man. Look like a cookie, yes. Okay. All right, so another plane that you need to remember is this. If you are looking from the third floor, a person who is doing, this is the nose. So if you're looking from the third floor, third story, floor, story, whatever, so you see the head, right, and the nose. So if you cut the patient like this, like a bagel, you stand up a bagel and cut it in half, that is called the frontal plane. Frontal or coronal plane. Right? So that is coronal or frontal plane. So in conclusion, the sagittal plane, mid-sagittal plane, or parasagittal plane cut into right and left. The transverse plane cutting into superior and inferior. The frontal or coronal plane are going to cut in anterior and posterior. Okay?
Go ahead, Dr. J.
All right, so let's have a small break, 10 minutes. We're going to talk, we are going to finish on time. All right, so far, how is the class? Excellent, very good. So I'm going to ask your opinion at the end, as I used to do all the time. All right, so I will see you 1:20. All right, see you then. Hello, Erika. Erika.
Dr. G.
Yes.
Hi, this is Shauna. I just want to let you know that I'm present. I signed in after you took attendance.
I put you absent. Okay, so remind me at the end, okay?
Okay. Thank you.
Yeah. Erika, are you there?
Yes, I'm here. Let me turn on my video.
What is that? What is that picture? What is this? You're upside down? What are you doing?
Yeah, that was a long time ago. I was at work. I used to work graveyard shifts, so we can kind of get away with stuff like that.
Okay. You will tell me details later. I know it. I'm curious. All right, so let's get started. Please, everybody, cameras on, please. Alma, Marilyn, Justice, please. Okay.
Dr. G, your camera's off.
Okay. Thank you. All right, so let's keep going with the last part of the lecture today. We are going to talk about chemistry. Okay, so this is a review again. I'm going to try to make some remarks, especially I want to talk about pH. Okay. Chemistry. Chemistry is actually the deal with the composition of properties of the matter. Okay, matter. What is matter? Matter is the small matter is an area who has some structure, composed by structures. So what is a matter? Matter is composed by atoms and molecules. Matter. So the atom is the smallest unit of matter. So atom is the smallest unit of matter. Matter, for example, we have any element, water, air, those are matter because they have molecules of oxygen, right? Water in the fluid, etc. So atoms is the smallest component of matter. All right, so here we are going to make a very brief summary about this because, all right, so I'm going to make a summary here. Number one. So the atom is composed by a nucleus and the orbit. The nucleus are going to be composed by protons that are positive and the neutrons. They don't have charge. There is no positive, no negative. And orbits are going to be composed by electrons. Electrons. These electrons are negative charge. All right, so let's get started. The number of protons in an element or mineral, the number of protons is exactly the same number of neutrons. And this is exactly the same number of electrons. Okay? So we have protons, neutrons, and electrons. So those are the same number. For example, if you have here sodium, sodium is going to have 11. 11 protons. So that means 11 positive charges, 11. And we have 11 electrons. We have negative charge. So the number of protons is the same number of electrons. So that means that we have 11 positive charges, and 11 negative charge. So if you make a summation of all of these, 11 plus 11 minus 11 is 0. All right, so that means the elements or minerals in the periodic table do not have a charge. When they lose or gain electrons is where they are going to turn into ions, into ions. Okay. All right, so saying that, I need to talk about ions first. Ions. Ions are going to be cations or anions. Negative, and this is positive. Electrolytes are going to be called ions in body fluids. Okay? All right, so there is one more term that you need to remember. That is called the isotopes. Isotopes are going to be basically isotope produce radioactivity. These isotopes are used for chemotherapies, radiotherapies. So why? Because you know that radiation can kill cells, especially cells who divide very fast, like cancer cells. Isotopes can be used as a treatment. Isotopes can be used as a diagnosis. For example, they have isotopes when you have hyperthyroidism, because part of the thyroid gland produce much more T3 and T4, and you give isotopes. These isotopes destroy these nodules and get into normal thyroid gland. Just to make it simple. I'm not going to elaborate more. But what is an isotope? An isotope, for example, we have iodine 131, technetium 121, I guess. Technetium. This is iodine. This is technetium. All right, so this 131, what does it mean? So what is an isotope? An isotope is not an ion, because isotopes do not have a positive or negative charge. Isotope is going to release radiation when they lost one or more neutrons. So isotopes are going to be basically the loss of neutrons. When they lose neutrons, the nucleus become unstable and start to produce radiation. So that is isotope. Isotope, they have medical uses for treatment or and diagnosis. You okay with that?
Yes.
Okay.
Yep.
So here we have the periodic table. If you see here, francium have 87 what? 87 protons, neutrons, and electrons. Cesium have 55 what? 55 protons, 55 neutrons, 55 electrons. Rubidium, 37 protons, 37 neutrons, 37 electrons. Potassium, 19 electrons, 19 protons, 19 neutrons. Sodium, the same. Lithium, the same. Hydrogen is going to be 1. Look at this. Hydrogen is very important. Hydrogen is the most abundant element in the universe. Hydrogen, we have 1. That's what I tell, like similar to the previous one, right? 1. You have 1 proton, 1 electron, and 1 neutron. We are not going to draw the neutron here. So let's draw an hydrogen. Hydrogen, we have a central that is a proton and an electron. An electron, negative. So that is an hydrogen. All this is an hydrogen. But when the hydrogen loses the electron in the peripheral area, when they're going to lose they lose the electron. So the electron is gone. So what is remaining? And a proton. So that's why hydrogen are going to write down like this. H positive. H positive. So H positive, that is what is exactly the same as this. So H positive is an hydrogen who loses the electron, the only electron, and that is going to be a proton. So hydrogen positive means a proton. Hydrogen positive is a proton. You okay with that? Now, when you lose, listen, when you lose electrons, that substance is acid. The hydrogen he lost the hydrogen, the electron, and when they lost the hydrogen, the electron, I mean, they're donating the electron, this is an acid. This is acid. So hydrogen is very acid. Okay? Now, one more example here. Let's go to the sodium. The sodium is 11, right? So we have here, according to the orbits, we have in the first orbit, we have maximum 2 electrons. In the second orbit, maximum, you have 8 electrons. In the third orbit, you have maximum 8 electrons. Fourth, 18, then 36, 72, etc. So, but just remember the first 3 ones. All right, so that means that, what does it mean? So if the first orbit contains 2 electrons, that orbit is stable, energetically stable. What does it mean? That they don't need more energy or less energy. They are very happy with the amount of energy that electron is giving. Electron, just remember, energy, electron, energy, E, electron, E, energy. So the energy that is given by the electron, 2 electrons in the first orbit, is to maintain the atom very happy, means there is a stable. In the second orbit, after you complete the 2 orbits in the 2 electrons in the first orbit, if you have 8 in the second orbit, that is again an unstable orbit. So you need, in the second orbit, you need to have 8 electrons in order to be stable. The sodium is going to be 11. So we have 11 positive in the center. We have -2 in the first orbit, -8 in the second orbit, 10, and -1 in the third orbit. So this orbit, first orbit, is happy. So stay there like this. The second orbit have complete electrons, is happy, 8. But the third orbit is unhappy. Why? Because you want to have 8 electrons, but you have only 1. So in order to make stable the whole atom, so what do you want to do? You want to gain 7 electrons to have -8, or to lose 1 electron. So what is easier to do? To gain 7 or to lose 1?
Lose 1.
To lose 1. So they're going to lose the 1, and what happened? You're going to have now, you lose that electron in the third orbit, and what happened now? You have 11 positive, but you have 2, -2, -8, -10. Plus 11 minus 10 is +1. So that's why sodium, when they lose the electron that is the most likely, going to be sodium positive. Okay? Is that clear?
Yes.
Okay, valency is going to be the number of electrons that are going to be gained or to lose. When they gain or lose electrons, that is called the valency or valence. Okay. All right, so let's talk about solutions. Okay. Solution. Solution is actually composed by solvent. I'm going to put solute first, plus the solvent. Solute will be the substrate or reactant. I will put some simple, let's make it sugar. Solvent, the universal solvent is the water. So sugar plus water combined are going to form what we call a solution. Okay? Solution is the combination of a solute. The other name of solute is the substrate or reactant. And solvent is just solvent. So there's different names, or. All right, so we have coffee. You like mojitos? Mojito is a solution. What are margaritas? What else you like? Cuba Libre. What else? Cuba Libre. What is Cuba Libre? What else? Oh, no. Manhattan. Cosmopolitan. Whatever, right? So those are solutions. All right, so let's make a summary about the bonds. And we are going to focus in the carbohydrates and pH. Okay, we are going to make a summary. Are you ready? Bonds. Bonds are going to be ionic and covalent. Ionic are going to be marriage for money. Money, money, money. Yes or no?
Yes.
So what does it mean? If you have here a nucleus of one atom and another nucleus of another atom, and these atoms, they have his own electrons. Ionic bond is when one of these atoms are going to take all the electrons from the other one. So all the, I think like the atom is going to be naked. Why? Because this is ionic bond. The money, who is the money? The electrons. So I take all the money because I have a marriage for money. I don't care about you. I care about the money. Money, money, right? So I take all your money. So that is ionic. Covalent are going to share. It's going to be a marriage for love. I don't know. I never do this, but anyhow, love. Okay, look like the fingers. Okay, love. Covalent is for love. Ionic, the best example are going to be sodium chloride, that is the salt in water. You put salt in the water, the salt doesn't keep together anymore. They're totally dissolved, right? So that is ionic bond. The covalent are going to be divided in the polar and no polar. The polar, the best example is water. The no polar, the best example is fat. So water is a covalent polar. You can say, look at this, please, pay attention. What is water? Water is a polar molecule. Yes, it's correct. You can say covalent polar is, the water is covalent polar. So in general, water is covalent. You want to be more specific, you can say covalent polar or just polar. When you say polar alone, that is understood that is a covalent bond. So what is water? Water is a covalent polar. Okay? A covalent no polar is the fat. Covalent no polar. So what is the difference? Because this is marriage for love, and this is marriage for love as well. What is the difference? The more love, more love are going to be in a no polar. They are sharing everything, 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 everything. The polar are going to share as well, but not as much as the no polar. So the strongest relationship is the marriage who has more love, correct? So the strongest bonds are going to be the no polar bonds. You okay with that?
Yes.
Okay. Ionic bonds are going to be hydrophilic. Polar is hydrophilic. And no polar is hydrophobic. So water is hydrophilic. Hydro means water, philic means attraction. Okay? So if you put one drop of water close to another drop of water, what happens? They are actually getting together. If you put, for example, fat in oil, fat in water, water is hydrophilic and fat is hydrophobic. Okay? Hydro means hydro water, phobic hate. They don't like water. They're trying to go away from that water. So that's why when you go to the kitchen and you prepare your, let's put it, vinegar with oil, vinegar is basically acetic acid is hydrophilic and the oil is hydrophobic. So you mix it, they're going to mix, but after a while, you see that they're going to separate because they don't like each other. That is hydrophobic. So the best example of hydrophobic are fat. What is fat? Is a covalent no polar or no polar. You can say no polar because if you say no polar, it's understood that it's already talking about covalent. What is the best example of hydrophilic? Water. Water is what is water? It's a polar molecule. Or you can say a covalent polar molecule. Okay? You okay with that? I hope it's that clear.
It's clear.
Okay. Okay, okay. All right, so I'm going to talk about pH at the end, but basically I want to finish the carbohydrates first. Okay, talking about carbohydrates, black. This is what you need to remember. Carbohydrates are going to be monosaccharides and we're going to do the polysaccharides. no. Disaccharides. And the polysaccharides. Monosaccharides are going to be the glucose, the fructose, and the galactose. If you add one glucose to each of them, plus glucose, plus glucose, plus glucose, they're going to give you the disaccharides. Glucose plus glucose, two molecules of glucose, are going to give you the maltose. The fructose are going to be the glucose plus the fructose are going to be the sucrose. And the galactose plus the glucose are going to be the lactose. Maltose you're going to find in the beer. Sucrose in the sugar table or sugar table or table sugar? Sugar table, right?
Table sugar.
Table sugar. Okay. Thank you. Table sugar. And lactose are going to be the milk. So these need to be known very well. Why you need to know this? Because monosaccharides are going to be, in addition to that, you need to remember they are being absorbed by facilitate diffusion. This facilitate diffusion happen only when they are in the monosaccharides. Talking about carbohydrates, right? And glucose can be passing through facilitate diffusion, cell membrane transportation. In the polysaccharides, you need to remember the starch and the glycogen. Starch, glycogen, what else? Cellulose. Cellulose is the fiber from the plants. Glycogen are going to be hundreds of molecules of glucose together. They're going to be a storage in the liver and muscles. Glycogen. Glycogen is the storage of glucose. When you take excess of glucose, you're going to deposit glycogen, where in the muscles and the liver, as maximum 2 pounds. When you are still eating carbohydrates, there's no way to form more glycogen because you already complete all the storage of glycogen. So what happens with the excess of surplus of carbohydrates? They're going to turn into fats. ¿Me queda vida?
Yep.
Okay. All right, so let's see what else I have here. Okay, so lipids. Talking about lipids or fats, they are going to be classified in 3. That is what you're going to use. When you see this fire, that is midterm or final exam. Lipids, we have the fatty acids, we have the triglycerides, and we have the cholesterol. What is cholesterol? Fat. What is triglycerides? Fat. What is fatty acid? Fat. What are the triglycerides? Fats. What are cholesterol? Fat. What is fatty acid? Fat. Example of fat: fat, fatty acids, fat, triglycerides, fat, cholesterol. Okay with that? So that is the minimum that you need to remember about the classification of the lipids. Okay? The fatty acids then are going to be divided in saturate, animal fat, and unsaturated, that is vegetable oil. The unsaturated will be the monounsaturated and the polyunsaturated. The polyunsaturated will be the olive oil, and the monounsaturated will be is going to be canola, going to be peanut oil. Those are actually the poly and the unsaturated are going to be cardiovascular protective. All right. Talking about proteins. Proteins, we have the monomer. The monomer for proteins are going to be the amino acids. The monomer for carbohydrates is glucose, fructose, and galactose. The monomer for fats is going to be the fatty acids. Fatty acids. Okay. The monomer for proteins are going to be the amino acids. Amino, that we have a group NH2 associated with a group COOH, that is the amino acid. Amino acid. Amino acid. All right, so just remember the first source of energy that we have is going to be carbohydrates. The second source are going to be fat. The last source will be proteins. All right, so let's talk about the pH. Okay, pH, and that is a review because you already saw this in bioscience. pH means the power, P of power, of H hydrogens. You already know the hydrogen positive is donating an electron, so that is an acid. Acid. Now, the one who receive electron, the opposite, are going to be, and the best example is the bicarbonate, and that is alkaline. So basically in the body we have acid, hydrogen, and the opposite is the bicarbonate. So you need to know both names. The formula, HCO3 minus, and all called bicarbonate, is alkaline. That is a must. ¿Me queda vida?
Yep.
Okay. Second, let's talk about the pH. The pH range, power of hydrogens, are going to have okay. This is pH 7, 0, 14. So this is acid. The more closer to 0 is acid. The more closer to 14 is alkaline. You can say base, but base in medicine, we don't use base. Base mostly is a word that's used for the chemist, in chemistry, right? We use mostly in medicine, we use alkaline. Base and alkaline are the same, but we talk in different way, right? So alkaline is high pH, and acid is going to be low pH. All right, so here 7 is the middle, is a neutral pH. Neutral pH. So let's like imagine acid is like very hot and alkaline like very cold. You mix acid with cold, in the midpoint is actually neutral. It's warm, warm water. Now let's put some decorations here. Here we have pH 2, that is the gastric acid. pH 6 is the urine and the bile. pH 12 is the pancreatic juice. Yes. And pH 7 is water. Water. Okay. So these values you must need to know. You need to remember these values. Okay. Gastric acid is pH 2. Sounds ugly, but you say stomach. Two. Stomach. Right? 2. Just to remember the pH of the stomach, gastric acid is 2. Urine, pH 6. Again, this is the urinary bladder, and this is the urethra. What number I have? 6. This is the urine pH. This is important. I'm not saying just for whatever, because when you have a UTI, urinary tract infection, the pH is going to be higher, alkaline. The urine pH normally is acid, because remember this, bacteria hate acidity. Bacteria hate acidity. pH 12 is the pancreatic use. The pancreatic use that is formed, this is bioscience. Whatever I said, if you don't know, go tonight and review all your lectures from bioscience. Okay? So pancreatic use are going to be composed by lipase, protease, amylase, bicarbonate, water, and electrolytes. Right? So you must remember that. Now, the pH of the blood, question for the exam. The pH of the blood is going to be blood pH,
7.4.
excellent, 735 to 745. Okay? So this is neutral. 735 is here, and 745 is here. So that is the pH of the blood. But now, let's see something here. There is actually a condition here. You know that 735 and 745 is on the side of alkaline. On the right side is alkaline. But when we are talking about blood, when you have 7.34 here, just before here, even though in the graphic show alkaline is considered a blood acid already. So 734 is acid, 733 is acid, 735 is normal. Okay? Obviously, 7 to 46 or more, that is alkaline. You okay with that?
Yes.
And the last thing I want to talk to you is about the buffers. This is something that you need to remember, buffer. Buffer is a substance who are going to keep the pH, the blood pH, in normal values. For example, this is the only example I'm going to give you. Here we have a red blood cell. Red blood cell. And here we have molecules of hemoglobin. I can say hemoglobin because we talk that in bioscience, right? Hemoglobin, 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 hemoglobin. We have 20. Okay, can you excuse me, please? Hello? Hello? Okay. So this is the hemoglobin. Hemoglobin, we have 24,000 molecules of hemoglobin. It's not like one hemoglobin only. We have 24,000 molecules of hemoglobin. What is hemoglobin? It's a protein. It's a type of a protein. Now, here we have in the blood, we have acid. This acid, normally we have pH 7.7, 35, 744, 45. So we have some hydrogens here. That is normal. That is normal. But what happens if you have too much hydrogens? If you have too much hydrogens, that means that your blood becomes acidotic. And what happened? So this is an excess. That is an excess of hydrogens. This excess of hydrogens are going to be taken by the hemoglobin of the red blood cell, removing that excess of hydrogens from the blood, making the pH normal between 735 again to 745. So what happened that the acidosis is being resolved. Why? Because the hydrogens are being taken by the hemoglobin. So removing the extra acid from the blood into the red blood cell. In this process to keep the balance of the pH in blood, these substances are going to be called, this hemoglobin is called buffer. So when you have an imbalance of acid or alkaline, buffers are going to help to keep the normal pH of blood as before. You okay with that?
Yes.
Okay. So that's all what I have for you today. I was a little bit slow. Those who already know me, I was like half machine. I was not a really full machine right now. Anyhow, so how was the lecture today? So let's start with Justice. Tell me.
It was great. It was pretty much a fast-paced lecture, but I got it.
Okay. Erin?
Pretty good. It was like how EMB class was. It was a lot of review from the previous class, and it went pretty well.
Excellent. Steffi? Stephanie?
Oh, I'm sorry. It was great. It was most of the stuff that we reviewed in the previous class.
Anything that can improve or can be better or extra explanation, this is the time you can tell me. Okay? This is for everybody. Thank you, Steffi. Erika?
No, it was really good to go over a lot of the stuff that we went over during EMB. Just kind of, it's just good to have a refresher in general, just to make sure that like it's up to date.
Yeah, so everybody review. If you have some topics that are gaps or spaces, blanks in your mind, so please go and review that, okay? Shanna, please, your comments. Thank you, Erika. Shanna can.
It was informative, and like everyone said, it was a review, so it was good to go over that.
Thank you. Miss Alma?
So yeah, just piggybacking. It was good to get a little extra tidbits from you, a little more information on bringing it together. So that was good.
Okay. Thank you. Revi?
Is it?
Revi?
So it's like a movie. Like you don't want to go to the bathroom because you don't want to miss anything. So you make it very animated and entertaining. So
Oh,
it's amazing.
thank you, Miss Revi. Thank you so much. Thank you. I appreciate that.
Welcome.
Miss Oh.
Yeah. Just quite some of the review from the last class, and it's good.
Okay, thank you. Mr. Daniel, please.
Good refresher. Just sharpening up some past review stuff.
Thank you. Marilyn Turla, please.
Yeah, everything was good. I agree with everyone. It was nice to get a refresher on everything. So thank you.
Okay. Jessica Garcia, any comment, please?
Yeah, it's really good refresher as well. I like the way you draw like things out because I like to see things, so it's really nice to see all of that. Good job.
Thank you. And you ask me any question, okay? If I don't know, I will tell you I don't know.
Sounds
But
good.
yes,
Thank you.
squeeze my brain, okay? As much as you can. Jacqueline, please.
Same thing. I like how it was a refresher from the last course that we took. I do like how you point out during the lecture, like where to pay attention a lot more. You're repetitive, so it's kind of like keeps our attention to things that we should be paying attention more. You do comment on those things. That's what I like.
Thank you. Thank you, Jacqueline. Chris? Chris Cisneros? Emerald?
It was good.
Okay. Okay, ma'am. Well, thank you. Then, Danielle?
It was good. I liked the little diagrams you drew. It was cute, and then the little comparisons you made. It was nice. It was nice. Yeah, it was like a nice way to put it. And yeah, it was a really good refresher. It's basically everything. Just review. Yeah.
Excellent. Miss Marcel, please. Your overall.
Everything was good, Dr. G. No complaints. I just have a question. Are we doing a Super Sunday this weekend?
I'm not sure. Depends how I'm feeling, because right now I'm going to the hospital. I don't know what they're going to tell me.
Just feel better, Dr. G.